ado, let's go ahead and begin. And I made it Christmas themed. A nurse is caring for a patient with peripheral edema and should identify that which of the following nutrients regulates extracellular fluid volume. Good job, guys. It is our sodium. Where salt goes, water flows. So sodium is going to be our main electrolyte and nutrient that is going to regulate our extracellular fluid volume. Think about when we give our patients hypotonic versus isotonic versus hypertonic solutions, all of which are going to help regulate our fluid volume. A patient just learned that his liver has regenerated after partial removal. This is due to which physiological principle? Awesome, our compensatory hyperplasia. So hyperplasia, that's our increase in cell size and number. So very good job. It would not be our metaplasia. That involves some different tissue stuff going on. But think about our example from our patient who is working out. This one is select all that apply. Which statement is true concerning dysplasia? Awesome job, guys. So remember our dysplasia. This is like our Barrett's epithelium, where we're having a, again, it's the same cell, but it's just got a different phenotype. It's just different. And this is often going to increase our risk for cancer because now my cell has underwent cellular changes. Okay, and these changes are not good, usually from that chronic irritation. So think of your Barrett's epithelium with a GERD. A client has developed cell atrophy. The most likely cause would be good job, guys. Ischemia. Remember our ischemia and necrosis leading to that apoptosis. That is our most often cause of cell atrophy. And again, if anyone has any questions, you can type them in the chat. You can unmute yourself. I'm here to help. Two months after chemo, a lymphoma decreases in size as documented on abdominal CT scans. What mechanism caused this? Good job, guys. Apoptosis. So that is our normal cell death. So with chemotherapy, what's happening here is that the cells are being destroyed and then my cells notice that something is happening that they don't like, and they're going to trigger apoptosis. Remember, cancer occurs from a failure in apoptosis. Therefore, when we go from chemo, that's going to help re-trigger that apoptosis. So good job, guys. Water movement between the ICF and the ECF compartment is determined by good job, guys. Osmotic forces. That is fluid and water moving from an area of high concentration to an area of low concentration. Typically, high concentration is going to really drive that movement. So very good job, guys. Osmosis. A nurse is caring for a patient who develops deep, rapid respirations. An ABG shows the following. The patient is experiencing good job, guys. That was metabolic acidosis. So the first step is always determining what our pH is. Which of the following does not describe phagocytosis? Good job, guys. So phagocytosis is not part of our inflammatory process. It is something different than that. A nurse is caring for a patient with a gastric ulcer. The nurse should explain that prolonged exposure to stress also causes awesome job, guys. So remember our stress, our HPA axis, it secretes cortisol. So yes, if we have chronic stress, we're at risk for hyperglycemia. Remember, stress also decreases our immune response and it puts us at risk for hypertension. A nurse is admitting a child who has Wilms tumor. Which of the following actions should the nurse take? Good job, guys. So remember, with our Wilms tumor, we want to avoid palpating the abdomen to prevent an encapsulated tumor from spreading and popping open. A nurse monitors for increased intracranial pressure on a patient with a leaking cerebral aneurysm. What findings indicate an increase in ICP? Good job, guys. So all of the following are increase in ICP. What's interesting about Cushing's triad is that we'll actually start to see the patient bradying down. I do want to answer a few questions that are in the chat. Is phagocytosis part of our second line of defense? So, with our first and second line of defense, these are our non-specific responses. So our first line of defense, that's what's going to consist of our physical barriers, mechanical barriers, chemical barriers, etc. Our second line of defense kicks in when all of our barriers, per se, fail. Our third line of defense, that involves our B cells, our T cells, and that produces a specific response. That is our third line of defense. So phagocytosis is going to be part of our second line of defense. A nurse is preparing to administer an osmotic diuretic IV to a patient with increased ICP. This solution is used to Good job, guys. So remember, this osmotic diuretic is going to help us pull water from the brain, head area, the skull, to try to help decrease some of that intracranial pressure. A nurse is educating a patient with a new diagnosis of multiple sclerosis. When asked about the cause, how should the nurse respond? Good job, guys. So usually with MS, there's multiple different kinds. There's your relapsing remitting, etc. But just know, remember, with multiple sclerosis, we really need to prevent these exacerbations because not only are they pretty limiting and debilitating to the patient, but remember, they can never go back to baseline. A nurse is providing teaching to the family of a patient with a new diagnosis of ALS. Which of the following findings is an early manifestation of ALS? What's an early manifestation? Good job, guys. So an early manifestation is going to be weakness of the distal extremities. Remember, with ALS, it starts at the fingertips and it kind of creeps inward till it hits the lungs and we get that respiratory paralysis. Remember, ALS really doesn't affect their sensory system. It's more just your muscular system. And they remain fully aware as well. A nurse is preparing to admit a client who has myasthenia gravis. What supplies should I have at bedside? Good job, guys. So remember with our myasthenia gravis, they can sometimes have some dysphagia, especially in their myasthenic crisis. So always making sure that at the bedside we have suction. It's going to be really important because remember they're at risk for aspiration, and what can come from aspiration, that puts them at increased risk for aspiration pneumonia. A nurse is providing teaching to a patient with a new diagnosis of myasthenia gravis. What teaching should she include? Good job, guys. So really with myasthenia gravis, our focus is going to prevent our myasthenic crisis. So what causes our crises? Of autonomic instability, that's under medication. So really making sure that these patients take their meds. Additionally, hot baths can be triggers for them to go into an episode. So we want to avoid harsh temperature changes. And enemas are rarely ever prescribed for patients. If they're prescribed an enema, it's usually due to constipation that is more like impaction based. So if you ever see enema, it's usually not the right answer. This one is select all that apply. A nurse is teaching a patient with an autoimmune disease about long-term corticosteroid therapy. Adverse effects include all right, good job, everyone. Remember, corticosteroids help suppress the immune system. They also put my patients at risk for Cushing's. So, osteoporosis, increased risk of infection, and moon-shaped face are all correct. Additionally, these patients are at risk for weight gain as well. Another select all that apply. A nurse is teaching a client who has diabetes mellitus. Which of the following should the nurse include as an expected finding of DKA? All right, good job, guys. Remember with diabetic ketoacidosis, I am having an acidic state, which in order to compensate for all that acid building up, I'm going to try to breathe off all that carbon dioxide. So that's where Kussmaul's come in. Additionally, they have ketones in the urine and extremely high blood glucose levels. So remember, they will be pretty acidotic. And remember, with our hyperkalemia, that's our hot, dry, sugar high. So they would be pretty hot. They wouldn't be shivering and they would have dry skin. A nurse is teaching a patient about the ACTH stimulation test. The nurse explains the purpose of the test is to assess for Good job, guys. So our ACTH, that is our Addison's disease. That is our Addison's disease because remember, they're having hypo. So that's when we're trying to see if we give them any ACTH, if it will increase their levels. A nurse is admitting a client who has hyperthyroidism. Which of the following would the patient present with? Good job, guys. So remember, the thyroid hormone gives us energy. So with all of that energy, I'm going to be sweaty. I'm probably not going to be sleeping much. I'm going to have some tremors. Additionally, I'm not going to be tired and I'm not going to be shivering. And typically, these patients won't have any syncope. A nurse is assessing a patient who has SIADH. Which of the following findings should the nurse report to the provider? So remember, what is SIADH? What do these patients look like? Good job, guys. So they are they are big and bloated because they're holding on to a lot of water. What happens when we have so much water? It's going to throw off our ratio of salt to water, so we're going to be hyponatremic. A nurse is assessing a 12-year-old newborn and notes mild jaundice of the face and trunk. Which of the following actions should she take? Awesome job, guys. So what we need to do before we ever do anything is we need to assess our patient. So while phototherapy is a very good option for these patients, before I start that, I need to get a bilirubin level so I know my baseline, so I know kind of what I'm working with, and I have data to compare. Good job, guys. And that will help you answer nursing school questions till the day you graduate. While some of the answers might be the proper treatment, you always need to assess first. A nurse reviews lab reports of a patient and notes elevated TSH levels. Which of the following findings are expected? So if I have an increase in TSH, what do you think is happening? All right, guys. So let's break it down. So, what disease process has an increase in thyroid stimulating hormone? It's actually going to be our hypothyroidism. Because of hypothyroidism, I have a loss of T3 and T4. T3 and T4 give me energy. If I don't have T3 and T4, my body's going to try to compensate by increasing my thyroid stimulating hormone level. However, usually this won't work because there's more underlying conditions. Therefore, an increased TSH level is indicative of hypothyroidism. What is happening with hypothyroidism? They have a slow metabolism. So, what sign and symptom is indicative of a slow metabolism? It's going to be our bradycardia. A nurse is caring for a client who has thrombocytopenia and develops epistaxis. Which of the following actions should the nurse take? Good job, guys. You want to apply pressure to the nose for 10 minutes. Additionally, we don't want them to look up because that can cause blood to go down the esophagus, and that's not good. All right, guys. A 6-year-old child with sickle cell disease is admitted with a vaso-occlusive crisis. What are the priority concerns? We're going to select all that apply. All right, good job, guys. So, yes, we want to hop to it. We want to hydrate, oxygen supplement, pain management, prevent infection. Good job, guys. You are killing the game. A nurse is creating a care plan for a child with sickle cell anemia. Which of the following interventions should the nurse include in the care plan? All right, good job, guys. So, in in sickle cell anemia, we need to be watching their potassium levels because they're at increased risk for hypokalemia. That's just part of the patho behind sickle cell anemia. Additionally, the cold compresses aren't going to help their joints. We want to put some warm heat on them. And they're in very intense pain. So meperidine probably isn't going to help them. Ideally, we want them on a morphine pump, PCA. A nurse is monitoring a patient who had a myocardial infarction. What complications should the nurse monitor for? All right, good job, guys. So remember, with our myocardial infarction, we're concerned for dysrhythmias. A nurse is collecting data from a client who has right-sided heart failure. Which of the following findings should the nurse expect? Awesome job, guys. So remember, right-sided heart failure, it's going to rock the body with fluid. Therefore, you're going to have that edema. All right, a nurse is assessing a patient with fluid volume overload from a cardiovascular disorder. Which of the following manifestations are expected? Good job, guys. So remember, fluid volume overload, you're going to have crackles, you're going to have JBD and an increase in heart rate. A nurse is caring for a patient who reports calf pain. What should the nurse do first? All right, guys, good job. So again, we always assess first. Additionally, if what I'm thinking is true, if I report calf pain, I'm thinking my patient might have a DVT. That's why I'm going to assess. I never want to elevate the extremity of a DVT because that could cause it to dislodge and travel, and then it could end up in my lungs, and then that would be a pulmonary embolism. Good job, Marisol. Answer streak of 7. A nurse is monitoring a patient with heart failure related to mitral stenosis, reporting shortness of breath. Which of the following conditions is expected? So think about, where's my mitral valve? What side of the heart is my mitral valve on? Yep, my mitral valve is on the left side of my heart. So, if I'm having, so that's how we can kind of figure out what type of heart failure the patient's having. If they're having heart failure related to mitral stenosis, there's an issue with the left side of my heart. Where is it going to back up to? It's going to back up into the lungs. That is why my patient is reporting shortness of breath. All right, guys. A patient reports feeling apprehensive and restless. Which of the following findings should the nurse recognize as an indication of a pulmonary embolism? Good job, guys. A sudden onset of dyspnea. Very good. A nurse is caring for a child with tetralogy of Fallot experiencing a hypercyanotic spell. Which of the following actions should she take? Good job, guys. So specifically, tetralogy of Fallot, we want to help them tripod. Very good. You are assessing the respiratory status of a patient with COPD. Which of the following findings is a manifestation of impending respiratory failure? Great job, guys. That tachycardia, that's going to indicate that my patient is not receiving adequate oxygenation because of their respiratory failure. So we're going to try to compensate pretty quickly with that tachycardia to increase that rate. After administering 100% oxygen via non-rebreather, the patient reports severe shortness of breath. Which of the following findings is a manifestation of ARDS, acute respiratory distress syndrome? Awesome job, guys. So remember, what is indicative of ARDS? It is that refractory hypoxia. So with ARDS, remember the alveoli fill with so much gunk, pus, and fluid that there's no longer room for gas exchange to occur. Therefore, no matter how much oxygen I give them, their O2 stats will not be normal. So if they're statting at 50, that's pretty indicative of ARDS. A nurse is developing a teaching plan about preventing acute asthma attacks. Which of the following points should be discussed first? Good job, guys. So if I'm teaching about prevention, I really need to assess my patient's baseline level of understanding before I can go ahead and teach. A nurse is teaching about daily chest physiotherapy to a patient with cystic fibrosis. Which of the following is the purpose of this treatment? Good job, guys. Remember, with cystic fibrosis, they have lots of secretions stuck in their airway. So their chest physiotherapy is going to help to loosen up those sticky, salty secretions. What's the primary cause of cor pulmonale? Awesome. Remember, pulmonary hypertension almost always will lead to cor pulmonale. What is cor pulmonale? That is heart failure. That is right-sided heart failure associated with pulmonary hypertension. Which of the following is more commonly associated with pulmonary hypertension? Awesome job, guys. Raynaud's phenomenon is almost always associated with pulmonary hypertension. A nurse is caring for a patient with chronic kidney disease. The kidneys regulate body fluids as well as assisting with which of the following functions? Awesome. Remember our buffer system when we talk about acidosis, alkalosis, if it's metabolic, think kidneys. The kidneys help us regulate. And they also have tons of other important functions. A nurse is teaching stages of acute kidney injury. What information should the nurse include about pre-renal azotemia? Good job, guys. So essentially, there is an issue with renal perfusion. See how it says pre-renal azotemia? Well, what is prerenal? It's an injury before the kidney. So, what injury occurs before the kidney that thus impacts the kidney? Decreased perfusion. So, this is about prerenal, postrenal, etc. I love that name, Coffee for Life. Absolutely. You're reviewing labs for a patient with CKD reporting nausea and muscle weakness. Which of the following findings should you expect? Awesome job, guys. It is hyperkalemia because they are no longer excreting potassium. Additionally, that muscle weakness, that is our hyperkalemia. A nurse is providing teaching to a patient with frequent UTIs. What statement indicates a need for further teaching? Good job, guys. So, vaginal douches are really a big risk factor for UTIs. So, additionally, when we're teaching our patient, we want them to make sure they're frequently urinating, drinking lots of fluid, and loose cotton underwear is preferred. A female with recurrent cystitis asks about preventing future episodes. What statement requires further teaching? All right, good job, guys. Remember, cystitis, that's going to be inflammation of the bladder, etc. So it's usually from a UTI that progresses upward. So tub baths, it is not a good idea. Additionally, we do want our patients to not use feminine hygiene products. So by my patient saying, I will not use feminine hygiene products, that is good. A patient reporting dysmenorrhea asks about alternative therapies. Which of the following statements should the patient should the nurse make? Good job, guys. So remember, it's totally okay for my patient to use some alternative medications, but we do want to follow up with our provider and really just assess and make sure that the medications are safe for the patient. Good job, friends. A nurse is teaching parents of school-aged females. What info regarding sexual maturation should the nurse include? Good job, guys. So we know that obesity is linked to early onset of puberty. Do you want to go back to a question we had in the chat? How can the patient realistically not use any feminine hygiene products? So kind of in these terms of feminine hygiene products, those won't include any sort of menstrual devices such as pads, cups, etc. When we talk about like feminine hygiene products, we're talking about like feminine washes, douches, perfumes, creams, lotions. That's kind of more the term for like feminine hygiene products. I do get these questions from like directly from ATI. So that's kind of what they mean by more your feminine hygiene products. They aren't talking about like pads, tampons, etc. Hope that helped. ATI is quite old. A nurse is assessing a 6-year-old child at a well child visit. Which of the following findings requires further assessment by the nurse? Good job, everyone. So remember when we were talking about our early onset of puberty in males? That's going to be one of their first indicators. And we know that if it's really happening before like kind of more 10 years old, that's really linked to more of their cancerous CNS lesions. So really we want to further our assessment and see what's going on, why the 6-year-old is going through puberty right now. Which of the following terms refers to difficult or painful sexual intercourse? Good job, guys. So that's going to be the dyspareunia. Um, amenorrhea is absence of menarche. Dysmenorrhea is painful menarche. And endometriosis, that is a disease process of the endometrial tissue. Which of the following may lead to the development of non-sexually transmitted pelvic inflammatory disease? All right, good job, everyone. So yes, all the above. Select all that apply. Potential long-term complications of untreated pelvic inflammatory disease include, select all that apply. Good job, guys. So yes, we are really scared for pain, infertility, and ectopic pregnancy. Additionally, with pelvic inflammatory disease, you can't spread PID. However, if your PID is caused by like an untreated STI, you could spread that STI. But if we're just talking about pelvic inflammatory disease, there's no risk for transmission for that, if that makes sense. A nurse is caring for a patient with a GI bleed from an expected lesion in the colon. What procedure is anticipated? Good job, guys. So usually we're going to get a colonoscopy. Very good. A nurse is assessing a patient who is experiencing a perforation of a peptic ulcer. Which of the following manifestations are expected? Good job, guys. So if we're ever expecting perforation, we're looking at that rigid board-like abdomen. Additionally, if we're talking about vital signs with perforation, you're actually going to see a decrease in blood pressure and an increase in heart rate. That's because as the blood pressure drops, my heart rate is going to try to increase to help compensate. Awesome. So proud of you all. What is the best place to find practice questions? So you can use ATI. ATI is very helpful. I also really like nurselabs.com. They have really, really good nursing practice questions, but some of them can be a little bit more complex health one, more med surg nursing type, but there's lots of different places for practice questions. And yes, I will 100% be sending you guys this Kahoot in a final email from me with more stuff I'll talk about at the end. A patient has diverticulitis with active inflammation. The nurse should instruct the patient to eat what foods? Awesome job, guys. Remember, we want the brat diet for these patients, the bananas, rice, applesauce, and toast. This is going to help kind of decrease the pain, inflammation, diarrhea, all the above. Good job, guys. So remember, with those upper GI bleeds, we're going to have emesis with a coffee ground appearance because that is digested blood. When caring for a patient with cirrhosis, a nurse should expect to gather what lab test to determine recent alcohol use? Awesome job, guys. We do the GGT test to determine alcohol use. Remember, with our liver cirrhosis, our number one risk factor is alcohol consumption. So if my patient tells me that they don't consume alcohol, yet they're in cirrhosis, I can do a GGT test to confirm. If that GTT test is negative, then I start thinking that there might be other causes to their liver cirrhosis, such as hepatitis A, B, or C. Which of the following is not a trigger that could exacerbate SLE? Awesome job. So exercise does not trigger our SLE. We still want our patients to exercise, get in their mindful movement, but pregnancy, infection, and sunlight are all triggers for SLE, systemic lupus erythematous. A nurse is assessing a patient with a fractured left femur and in skeletal traction. Which of the following should the nurse report to the doctor? Good job, guys. So chest petechiae is a priority concern because I'm thinking that there is a fat embolism. To tackle these questions, we can look at things that are normal. So some drainage after a fractured femur, that is a little bit abnormal, but what would I report to my provider? I would report their lab values, that drainage isn't enough. Muscle spasms are also expected because they are in skeletal traction, and additionally, they are going to be in a bit of pain. But we're talking about priority, that chest petechiae is very indicative of a fat embolism, which we know is common after surgery, after bone surgery. A nurse is teaching about the difference between osteoarthritis and rheumatoid arthritis. Which of the following information should the nurse include about osteoarthritis? Good job, guys. Osteoarthritis, remember, that's our wear and tear. So usually their arthritis is going to occur at one joint on a single side of their body. Good job, guys. A nurse is discussing a care plan for a patient with osteomyelitis of an open wound. Which of the following information should the nurse include? Good job, guys. So, with our osteomyelitis, we really end up sending a lot of these patients home with a PICC line because they are going to require long-term antibiotic therapy, and we don't want to keep them in the hospital if they don't have to be. So we send them home with a PICC line. Very good job, guys. Osteomyelitis is an infection. It's not an autoimmune process. It occurs in the bones. And our chlamydia and gonorrhea, those are our STIs. So probably wouldn't cause a bone problem. Congratulations, Addison, 18 streak. A nurse is preparing a presentation about bone injuries. Which of the following types of fractures is especially common in children? Good job, guys. So with our pediatrics, they are usually going to have a lot of green stick fractures. Our compound fractures are a little bit more complex. Same thing with our oblique, not a lot of twisting, and depressed fractures, those are common with osteoporosis. Select all that apply. You suspect a patient with severe muscle trauma after a car crash has rhabdomyolysis. What signs and symptoms lead you to this? Good job, guys. So again, rhabdomyolysis really does impact the kidneys, so that's why we're seeing this elevated BUN. Additionally, they're going to have increased urine myoglobin levels because they're actually peeing out some of these some of the tissue that's kind of accumulating. Additionally, that's why we see that red-brown urine, decreased muscle strength, etc. And they would have elevated CK levels. Select all that apply. A nurse is teaching about the prevention of future uric acid stones. Which of the following suggestions should the nurse make? All right. So I do apologize. It should have been blue and green, not blue and yellow. That is my mistake. Sorry. I believe it should have just been blue because we actually do want to increase citric juices so they can help out. I believe it actually should have been blue and red because if we have gout, we want to promote exercise. We want to limit the intake of high purine foods. We want to increase our fluid intake. And we want to increase citric juices. So my bad, I accidentally selected yellow instead of red. My apologies.
Wait, did you say was it green or was it red?
So it should have been red.
Okay, thank you.
Yep. So with gout, we want to increase activity. We want to limit high purine foods. We want to increase fluids, and we do want our patients to be drinking citrus juices because that can actually help prevent the formation of these uric crystals. Which of the following are the two main symptoms of osteosarcomas? All right, good job, guys. Your symptoms will be pain and swelling. Select all that apply. A nurse is assessing a 1-week-old infant. The nurse should notify the provider about which of the following assessment findings. Good job, guys. So we really do want to notify our patient about blue coloring of the sclera. Additionally, this like blue pigmentation that can also be, we talk about it a lot more in women, children, family, but that could be indicative of another more complex disease. So that's totally okay if you didn't get the yellow portion right. This was from ATI, so it probably pooled women, children, family together. But for our purposes, blue coloring of the sclera, absolutely, that is osteogenesis imperfecta. Please. Select all that apply. The nurse should tell the parents of a child with Duchenne muscular dystrophy that progressive complications include Good job, guys. So with Duchenne muscular dystrophy, these patients are at risk for respiratory complications due to difficulties with their respiratory muscles. Additionally, they're at risk for contractures because they're not moving as much, obesity, pulmonary infections. Not at risk for the anorexia, dry skin. There's no mental changes, so they're not going to have that slurred speech, consciousness, etc. And this doesn't affect their bones in any way. It simply affects the skeletal muscle. A nurse is screening a patient with an S-shaped spinal column and unequal shoulder heights. What do these findings indicate? Good job, guys. So yes, that's going to be our scoliosis. After receiving an amputation due to Ewing sarcoma, a patient reports pain in the missing limb. Which of the following is the best response? Good job, guys. Yes. This is referring to phantom limb pain, which is completely normal. We want to go ahead and reassure them that it is temporary and it will subside. Why blue is incorrect is that we can't really teach a patient how to cope, and that's not a very therapeutic response as well. So this question will also help you with your patients that are care class. The pain is very real, and we can kind of help manage it. It will subside, etc. A nurse is assessing a client who has systemic scleroderma. Which of the following findings should the nurse expect? Good job, guys. So we are really scared for finger contractures with this scleroderma because it's kind of thickening of our skin, connective tissues, etc. A nurse is caring for a patient with a full thickness burn on 63% of her body and smoke inhalation. What's our priority action? So this is all about prioritizing care. Good job, guys. So we know that there was smoke inhalation. Although we are nervous about like all these full thickness burns, we always use our airway breathing circulation approach. So first, we always have to establish our airway. Then we can work on breathing, and then we can follow up with circulation. And then we'll work with the skin, we'll work with the temperature, but always ABC in that order. A nurse is assessing a client with partial thickness burns 72 hours ago. What should the nurse report to the provider? Good job, guys. So that increased temperature, we're really, really concerned about that. Edema, normal. Pain, normal. 30 milliliters an hour, also normal. When turning a patient, the nurse notes a shallow crater in the epidermis of the patient's sacral area. What stage is this pressure ulcer? Good job, guys. This is a stage 2 pressure ulcer. It's still in the epidermis, but it's going through multiple layers of the epidermis. A patient has been recently admitted with herpes zoster, and a patient care assistant asks if herpes zoster is contagious. You respond with, good job, guys. So herpes zoster is the reactivation of chickenpox. So if my patients already had chickenpox, they are protected. So while yes, it is contagious, yellow is the most correct. Select all that apply. A child was stung by a bee and is allergic to insect bites. Which of the following findings are expected if the kid develops anaphylaxis? Good job, guys. So if someone's experiencing anaphylaxis, they're going to have lots of nausea, urticaria, which is hives, stridor. Think just full allergic reaction. They really don't feel very well. Ah. So how come their blood pressure wouldn't increase? It would actually decrease because if we're progressing to anaphylaxis, now I'm having an issue with my airway, my breathing, and if I'm not, my blood pressure is going to drop. So with anaphylaxis, they actually have a drop in blood pressure with a compensatory increase in heart rate. It's all about compensation.